The India registry is the first prospective multi-center trial investigating the safety and efficacy of vacuum-assisted thromboaspiration system in patients with acute lower limb ischemia. So in a controlled setting, we were able to reveal that the device, Indigo system by Penumbra, is safe and effective as a primary therapy for any kind of embolism or thrombosis in a native artery or in occluded graft and endograft, and also as bailout therapy for embolism occurring during other endovascular procedures. The most significant data from our registry are, of course, the primary safety and efficacy data. From a safety point, we can say that the device is very safe. So we have no device-related serious adverse event, we have no dissection, we have no distal embolism, we have no major bleeding or hemolysis with the use of this device. From an efficacy point of view, we are very happy because we obtain, in a cohort of 150 patients, a technical success of 88.7% with the use of thromboaspiration system alone, and this technical success increased up to 95% with additional procedure, like additional PTA or stent, or in some cases, some selected cases with additional lysis, small amount of lysis. And these results of note are perfectly in line with the other publication reported some years ago. Was the PRISM trial, was a retrospective analysis of 79 patients with the same nice safety and efficacy result with this device. My treatment algorithm has changed a lot during the last years in my daily practice. Actually, I've been moving from open surgery, the surgical embolectomy, to hybrid, and finally to a frontline endovascular approach. A result from our investigation just gives more evidence for this kind of shift from open to endo. And this is perfectly in line with the recommendation from the most recent guidelines of the European Society of Vascular and Endovascular Surgery that just suggest that the thromboaspiration should be considered in all patients with acute lower limb ischemia, and in particular to those with severe Rutherford 2B acute lower limb ischemia. So in other words, getting more familiar with this technique, I have expanded indication for that technique. And so now in my center, this is the first line treatment in all cases of acute and chronic ischemia, and also in all cases where the clot is localized in small vessel, in the popliteal, below the knee or below the ankle vessel, where, from my point of view, is exactly where this device, the Indigo system, makes the difference in comparison to competitor. In the Indian registry, we just included patients with acute lower limb ischemia lasting less than 14 days, because this is the longevity of acute clot by definition. But again, getting more familiar with the technique, I also have treated clot with a longevity of 3, 4, or even 5 weeks. Of course, you have to be a little bit more familiar with the device. You have to complete your learning curve, and then you have to remember a couple of good tips and tricks. One of these, of course, is the use of separator, specifically designed guide-wise, that break up a little bit the clot at the level of the tip of the Indigo catheter, and then facilitate the ingestion of the clot into the catheter under continuous vacuum aspiration. And the second suggestion is the sizing of the catheter to the artery, the 1-to-1 ratio sizing. In other words, use the largest catheter as possible in the artery. I use a Cat 8 French. till the popliteal and tibial artery. Then I switch to cut 6 French for below the knee or below the ankle vessel. In this way I can really reach any located clot in the peripheral arteries.